I'm Jessie Gray. Welcome to Personalities. I don't think there's a family in the United States that hasn't been touched by cancer in some way. If your family hasn't, someone you know has. What about the people to whom the doctors say there's nothing more we can do for you? And what about the people who are looking for an alternate therapy for cancer, who don't want chemotherapy, radiation, or surgery? We're going to be talking to someone who can tell us about some of these alternative treatments today. A very interesting guest, Ruth Sackman. She's the director, I believe. Executive director, thank you, of the Foundation for Alternative Cancer Therapies. It's based here in New York. Thank you for being our guest, Mrs. Sackman, very much.
Thank you for inviting us.
What is F.A.C.T, known as the Foundation for Alternative Cancer Therapies, and why does it exist?
Well, it exists because of the failure of conventional treatment. There would be no point in promoting alternatives to conventional treatment if it were successful. Now, so often we've talked to doctors and they use the term cure. And the impression is left with most individuals that there are actual cures for cancer. The American Cancer Society usually states that it's about 30 or 40 or 50% cure. What they're actually saying is we achieve 5-year survival.
In other words, the word cure doesn't mean you're going to live out what it would have been your normal lifespan had you not gotten cancer. It
Not
simply
at all.
means a 5-year survival rate.
5 years survival. And it's truly unfortunate that they use the term cure simultaneously with the phrase 5 years survival, because too many people simply assume that they are going to be one of the 30% or 40%, which is quite high. Now we come to another aspect of the 30 or 40% claimed even for 5 years survival, and that is primarily Wilms tumor, Hodgkin's disease, skin cancer, and now some of the leukemias come into that area. And for most of the others, the vast majority of the others, it's what has to be termed zero survival.
Really?
In other words,
Zero?
they don't make the 5-year survival time. Now, from information that we have found, the cure rate, the more normal cure rate, would be about 7 or 8%.
Excluding the cancers you mentioned that have a higher rate of...
Now we're talking about those people who actually survive beyond the 5 years and seem to be survivors, recovered cancer victims, but true recovered cancer patients. Now we have to understand that those include the mistaken diagnoses and the spontaneous remissions. And not too long ago...
How many of those would you say there were?
Well, I can give you some statistics on breast cancer. There was a survey done not too long ago which reviewed 500 and some odd patients. It was about 507 patients that had breast cancers and mastectomies done. Out of that number, 58 of them were found to have had a mistaken diagnosis. The radical mastectomy was done unnecessarily. And 22 of them were found to have very doubtful situations.
Was this at one hospital?
No, this was a survey done that came out of the National Cancer Institute. It was...
Why is there a misdiagnosis? Because when a woman is on the, let's say, the operating table, she's had a biopsy, they send the skin tissue or whatever it is down to what's called pathology, and it's just the cells are looked at and a quick diagnosis is made of how these cells look,
the first
whether
diagnosis
cancerous or
is
not?
fairly quick. Actually, they'll in a breast cancer situation, they send it into pathology, and sometimes the pathologists are very doubtful about whether it's malignant or not, and in order to be safe, they'll lean over toward the malignancy side and remove the breast. And if radical is scheduled by the surgeon and the patient has agreed to it, then it will be a radical mastectomy. Subsequently, there is a more in-depth biopsy done, or pathology report done. We ought to put it this way, it's a pathology examination that is a 3-day process, and then it's quite possible through that process they determined that it was not
Is
really
that much
malignant.
more accurate?
That is an accurate
Would you advise
report.
a woman who had a lump in her breast and was scheduled for a biopsy to say, only take the lump out and wait 3 days for that more thorough report before you give me a mastectomy? I'm putting you on the spot, but it
Not
led to
really.
that.
I think, of course, our organization is based on a different philosophy of cancer, and it isn't up to us to make any
No.
judgment in that particular area. We could
But
provide facts in
this
that
is the
area.
information.
Yes, and of course, when we think anyone should use sound judgment to determine what they want to do for themselves,
One quick
without our
question.
recommendation.
Were the women whose reports were false, of course, were they ever told?
These 58 women are going to be notified.
They are going to
That's
be
right.
notified.
As a rule,
That ought to
most
be
women
the
do
case.
not ever hear that this was a mistaken diagnosis. And we feel that in many instances where patients come along and say, well, look, I had this surgery 20 years ago, whether it was breast or lung or some other kind of thing, and look at me, I'm a cured or recovered cancer patient. It's because they were not told. But these 58 women, we understand, are going to
Are
be
going-
notified.
That will
I
be an
think that they're-
interesting
Frankly, I
development.
think from some of the material we read these days, the conventional or establishment in cancer is taking a very different attitude. We think they're coming much closer to our kind of thinking
What
and
is your
notifying
thinking?
patients.
What alternatives do you offer?
All right, now let's talk about the alternatives. The support we're giving to alternatives is based on a very thorough investigation of work that has been done over possibly the last 50 years or longer, in which doctors, and many of them working independently of each other, came to the conclusion that cancer was a systemic problem, that there's a breakdown in the patient's body chemistry, and that body is producing abnormal cells. So that if you take a breast and remove it and discard so-called all of the cancer, and 3 or 4 years later there's a recurrence, it's because that same body reproduces the cells just as it did before.
You have not cured the total body at all, which was the
Not
basis
altered
for
the
the
body
disease.
chemistry.
You've simply taken out the largest
That's right.
visible section
Now-
of cancer.
Absolutely. Now, certainly there is, we would not take a hard position about the breast not being removed or the lump not being removed,
Right.
but we do say no matter what you do, at least give some attention to the body chemistry and see if you can't
Do something
bring that
more.
back to normal function. That's right. So that there isn't the continued reproduction of cancer cells.
What do you offer cancer patients at
If
FACT?
they call us,
Yes.
let me first, before we go into
All
that, I
right.
want to give them some idea of what I mean when I say we've done a thorough investigation of some work that was done in the past. And one of the things would
I
be
can
this
hold
book
this
by
up.
Dr. Max Gerson. Now, here's a doctor who has all of the proper credentials, who learned his craft through some experience of his own, to treat cancer through nutrition. He practiced right here in the New York area at Gotham Hospital. When he found he couldn't control the situation, the dietary situation for his patients,
At
he
the
opened
hospital?
at the hospital. It seemed as though some of these nurses or not orderlies, whatever they call them,
Aides.
nurses' aides, were bringing in hot dogs and things of that kind after hours to some of these patients. And he could tell when they were not responding that they had violated the diet. So he opened up a clinic in Nanuet, New York, where he treated cancer patients terminally ill. In that book, he has documented 50 patients. Only 2 of them were not terminal, and one was a relative who trusted her situation to him. Otherwise, they came in desperation. They had
After they
exhausted.
tried
They had
everything else.
exhausted everything else.
I might
and he
mention-
had a cure rate of about 35% with these patients.
Using mainly diet?
Diet.
and-
It actually, even the other things were in the dietary category.
I might mention the book is a cancer therapy, results of 50 cases, and I wanted to read on the back of the book, Albert Schweitzer says, "I see in him," meaning Dr. Gerson, "one of the most eminent geniuses in the history of medicine. Many of his basic ideas have been adopted without having his name connected to them, yet he has achieved more than seemed possible under adverse conditions. He leaves a legacy which commands attention and which will assure him his due place." And he says that, of course, he is one of the most eminent geniuses. This man was persecuted, wasn't he, Dr. Gerson?
I'd rather use the term harassed.
Harassed, all right. Why?
Well, he worked in the 1940s and 1950s. At that time, they just simply couldn't conceive that cancer could be treated dietarily any more than possibly many years ago when scurvy was a deadly disease on the same scale as cancer. They couldn't conceive that possibly vitamin C would be the answer to such a deadly disease. And I think that was the nature of the situation then, and they were still looking forward to using something like chemotherapy and radiation more successfully, and they went down that track. Today they know that these don't provide a cure. So there's much more receptivity to the dietary thinking, you know.
Well, there's more receptivity, but in the meantime, if doctors are meant to heal, why don't doctors, and you have many alternate therapies besides Dr. Gerson's, I know that you can offer people information about, why doesn't the so-called orthodox medical establishment say, wonderful, I'd like to hear more of this, I'd like to use it if the facts are legitimate, I want to investigate it? Why the rebellion? Why the harassment?
All right, it does not exist in the medical profession. It is the institutions. It's possible that the AMA is taking a non-receptive position, and we must differentiate between the AMA and the average doctor who is treating patients in hospitals and in offices. They are, from our experience, extremely compassionate people and truly dedicated to healing. You may find some exceptions who are in there for the money, but as a rule that can't be attributed to most doctors. But they're not in the research laboratory. They are in the active process of treating patients, and they must have the protocols established for them outside of their office and given to them so that when they treat a patient, it is going to, the patient will respond to the treatment exactly as he expects it. Now, the big villain we feel, of course, is our Food and Drug Administration. The country has been dependent upon that agency to see that they are not being given carcinogenic substances and to allow doctors to do their research. You have to apply to the Food and Drug Administration for a new drug investigational permit, and until they provide that permit, you are not allowed to treat human beings. You can treat animals if you like with one method or another, but not people. And the restrictions for researchers are so ridiculous that most of them just give up. We could go into Dr. Burton with the immunotherapy. Your audience,
Fine.
all right? Here was a doctor who developed a technique of helping the immune system to function better. And it is now accepted that that the immune system plays a part in cancer.
Yes, it does,
Yeah.
even by the most
I wish
strict
we had more
doctor.
time here so
Well,
we
you'll come
could
back.
we
Come
could
back.
go into how they have concluded that it is a factor. You see, they gave transplant patients immunosuppressant drugs, and then the incidence of cancer rose enormously in these patients as compared to the rest of society. So this is authentication that the immune system does play a role. So if we come across Dr. Burton, who has developed a technique so that he can help the patient's immune system function better in the interest of the cancer victim. Well, he's tried to get an IND from the Food and Drug Administration. And at one point he said to me, he said, it's ridiculous. They'll say, what kind of cancer do you want to treat specifically? And then confine him to that one kind of cancer. And why do you want to use that as the particular kind of cancer? Papers that must be signed, the procedure that you must go through. Why, it can cost $1 million before you're prepared to get that IND.
So you have to spend money to get money to even
Oh,
ask
this
for
isn't,
money.
no, this doesn't even mean that they're going to provide the funds.
No.
That's another problem. No, this is just to get approval
Oh,
from
just to
them
get
to
approval.
use immunotherapy on human beings, and the treatment itself will not harm anyone. We're dealing here with biological treatments that are of no harm whatsoever. So Dr. Burton took his research center and moved to Freeport in the Bahamas.
In the Bahamas. Do many of the doctors using these alternate treatments have to leave the country in order to continue their work?
Over the years, that's been the history of it, yes. Most of them have left the country. Some of them, of course, left to escape being jailed. There was a doctor working in Florida in a clinic there using what was called the coke therapy. And we don't have the time to go into depth about these therapies. Well, he lost his license. He had to sell the clinic in order to finance the court trial that he had to participate in, and he finally left the United States and went to the Azores. There were some patients of his left here in the United States. He treated them many years ago, 20 and 30 years ago, and they've since brought him back here, but his situation is very difficult. He's back here, but he is not practicing. He doesn't have his license. He came back because he wanted his children to have an education here in the United States.
Now, for the person looking for an alternate treatment, there are many, many good doctors who have left the country who might be practicing still here in the country using only diet to treat cancer with success. How does one differentiate between the legitimate doctor with a legitimate alternate therapy and the quack?
All right, that's an excellent question, because with the increased interest in diet as being beneficial for cancer, there are a lot of amateurs who are beginning to appear on the scene offering cancer victims nutritional therapy. Some of them are doing it simultaneously with their doctor's recommended treatment. Others, of course, are foregoing conventional treatment, leaving their doctors and submitting to this sort of thing. We're appalled by it ourselves, I must say, and we're discouraging it as much as possible and pointing out this to cancer people who call us, to look for a man's credentials, see what his training is. Ask even to talk to some of the recovered cancer victims, and we're not talking about a patient who suddenly feels as though she's better after 2 months of being under treatment. It's not a good enough yardstick, but you've got to look for those long-term recoveries. This is the criterion with cancer.
Does your organization do this for a patient? Perhaps weed out?
We do keep track of all of the good resources where the recovery of the patients has substantiated their work, yes.
Can people come to you for this information?
Yes, we have our telephone number. It's listed, of course, in the New York City telephone directory. We have chapters in other parts of the country, too. If they look in their telephone directories there, they'll find them.
Could you give us, it's the Foundation for Alternative Cancer Therapies, and your address?
It's Box HH, Old Chelsea Station, New York City, 10011. Telephone number is area code 212-741-2790. Do you want me to repeat that telephone number?
I'd love to have you.
It's area code 212-741-2790. Now we have chapters in Detroit, Denver, the St. Petersburg area of Florida. One will be starting in Philadelphia at the end of this month, and then we're proceeding into Boston. Another one in the Fort Lauderdale area of Florida.
And you will give people information. You also have an excellent, I might say, book list, and people can order the books from you or other organizations.
Absolutely. This can be very helpful, and we don't mind if people get in touch with us to send out this book list to them. And it can be used as a bibliography, either to get the books from us And we're a nonprofit organization, by the way. Although there's a profit on the books, it is all turned into the organization to be of service to those people who call, or if they find the books in their health food store or library, it doesn't matter, as long as they read them.
But it is a very good bibliography. You also have a, if people can join your group, can't they? And
Yes.
you have a bulletin that you send out is it every month?
Why don't you take, here's another one, just to show that there are different issues every other month.
Every other month, called Cancer Forum. And you hold meetings here in the New York area, don't you?
Yes, we do. We haven't been on schedule for the last year or so because actually we've been growing so rapidly we've had to take care of other things, but we will be coming back to a position of holding meetings. But we do hold a convention once a year, and that's a 2-day affair with doctors coming from all over the United States and Europe. We had a doctor in from Sweden, a doctor from Mexico last year, and previous year from other parts of Europe, and these can be very interesting.
You know, you had a doctor. I went to your convention, in fact, that's where I met you, and you've been so helpful to me, which I appreciate very much because I do have cancer in my own family. Now, you had a Dr. Ransberger who has a clinic in the Bahamas. He's a German doctor. He is doing in the Bahamas what is legal to do in West Germany, and which is therapies which are really basically non-toxic and which are funded by the West German government, covered by their medical insurance. And yet, the American public can't get it here. They have to go to the Bahamas. It just seems like an incredible situation.
There are more facilities in Europe and in Mexico than there are in the United States.
Is the cancer therapy using non-toxic therapy ahead in other countries?
I think Germany has always favored what they call health spas, and this might be sort of an extension of it to them, although they have a very rigid medical society there too, and pharmaceutical companies that want their supplies to be used. And there's a similarity between their institutions and ours. But as I say, they've also tolerated health spas, you know, hiking and mud packs, other things. So they're not so antagonistic to this sort of thing.
What role does diet, do you think, play in cancer?
We think it is the most important thing that
in preventing it as well as curing it?
Preventing and curing it, especially preventing it, and I think it's much more important to prevent it because cancer is at epidemic proportions. The last statistic we have was that the death rate rose 5.2%, whereas over 20 years there's been a rise of about 1%, 1.2%.
Suddenly in 1 year?
This was a 5.2%. This was the last statistic we have. So you can imagine what must be happening, that we're beginning to get to the point where all of these carcinogenic materials in the environment, which would include your food supply, and here I think you know that the World Health Organization has said 80 to 90% of cancer is environmentally induced, which means employment, food, water, air, all of these things are contributing factors. And with proper diet, at least if we can get an unpolluted diet.
Impossible, practically, isn't it?
Not really. There's absolutely no reason.
You can't go to a market and buy.
No, you can't today, but
vegetable.
certainly if we can straighten out the Food and Drug Administration, which is a government agency, which means it is our agency, that sort of thing can be straightened out readily. What we must see is that this agency is responsive to the consumer and not to the industry that they're supposed to regulate.
That's the
obliged.
Right, and as Carter said, he was going to try to eliminate the revolving door syndrome, which means that someone would go directly from the food industry into a position in the FDA, spend 2 years, go back to another position, and it just goes around and around and around. So of course it's self-serving.
And certainly there's another technique which we call the delayed bribe, where when people leave the agency after having held a job there for a considerable period of time and behaved properly according to the pharmaceutical industry, they then get a job in the industry. Do you see? Now, but that's not all. The Food and Drug Administration was on the carpet here for quite some time, and Representative Moss, or is it Senator Moss and Representative Benjamin Rosenthal asked the General Accounting Office to do an investigation of the Food and Drug Administration, and they turned up the fact that 134 people held 159 illegal interests.
Really?
Now, do you think that agency is representative of the people?
What's being done about it?
Well, we've got a new commissioner. This Dr. Donald Kennedy has been appointed by Carter, and at the present time, we just simply don't know whether there's going to be a change or not.
It seems
And
like such
it's so difficult trying to say, well, Kennedy, you're responsible for what went before, you see. So we have this waiting period, unfortunately, to see if there will be a change. But I must commend them for taking a position on saccharin, which wasn't very popular.
Right, but of course now they're backing down.
Not completely.
Not completely?
No, they're just backing down to the extent that it would be available for diabetics. And I can't argue with that.
Do you know our time is up? Would you please come back?
I'd
love
be
to have
delighted
you.
to come back.
We've been talking to Ruth Sackman. She's the Executive Director of the Foundation for Alternative Cancer Therapies. The program is Personalities. I'm Jessie Gray. Have a good week.